check. Testing 1, 2, 1. Check. Just going to read an article. Samsung's DeX is a clever way to turn your phone into a desktop computer. All good?
Testing 1, 2. Mic check. Mic check. Level 1. Testing 1, 2. Are you getting it? Testing 1, 2. Testing 1, 2. Testing check. Mic check 1. Podium mic check.
Nikki coming on a lot.
No, Nikki from me, that's okay. Oh, yeah. Yeah. We need some diversity on our side. Yeah, I think so. They'll be like, oh,
Probably leaves around 5:30, and we're going to go. And it's been I know. And we're going to stop We'll probably stop before we might even stop.
what size t-shirt are you?
I know, right?
Which one do you want? You like
My mom's got a columnist, I have to. I wish my mom.
Yay! One for the team.
One for the team? Okay, that's okay.
I love her work.
Exactly.
Yeah, I think you're going to be in trouble. I think you'll be in trouble.
My mom? Oh. Yeah, I remember.
Yeah, see, so here's your spot. Oh, it shows it on both sides. That's actually very nice. Yeah, it is, actually. Glad you see these things. Yeah, thanks for saving the spot.
Sure. Do you need any help? Do you want me to get some?
I've modeled a lot of
Oh, you did already? Okay, so let me just,
and I'll sit down and move this out of the way.
That's very bold. Oh, yeah, really? Okay.
Turn off this version pad, and it was like, we had a gate.
That's right. I can blackmail later. I have no problem with that.
Oh my goodness.
Blackmail. Facebook will like these pictures. I get it. You've been hanging around Vincent too long. Yeah, he rubs off on you. He's a comedian, man.
Just in the last few days, I've been able to do a lot more.
Would go Friday, Saturday, and come back on Sunday.
My healthcare? I had surgery at Suburban.
The national conference.
And then I did health and nine.
So I think we're ready. So we're live here. Welcome, everyone. Where the Cost lives at the Maryland Healthcare Commission. I want to thank you all for coming. My name is Ben Steffen. I'm the Executive Director of the Healthcare Commission. I want to thank you for joining us today to really celebrate the launch, the birth, if you will, of the Where the Cost initiative here in Maryland. The aim is to shed light on the price and quality of different services among Maryland hospitals and healthcare providers. Information that until now has been difficult for consumers to obtain in a readily usable way. I want to welcome our commissioners that are here, Commissioner Wong, former Commissioner Stollenwerk. I want to thank all of you for being in attendance. As most of you know, we're an independent regulatory commission, part of Maryland government, with a broad mission to focus on health system needs, promote informed decision-making, increase accountability, and improve access to care, focus on cost and quality of services to policymakers, purchasers, providers, and most importantly, to consumers. The Commission's vision for Maryland is to ensure that informed commissioners hold the healthcare system accountable and have access to affordable and appropriate healthcare services through programs here in Maryland that serve as models for the rest of the country. We are pleased today to have with us our panel of experts who also have affiliations with the Healthcare Commissions literally over 15 years. They will be introducing the Where the Cost initiative, and I want to introduce them now. First, you will hear from the MHCC chair, Dr. Bob Moffit, who is a senior fellow at the Center for Health Policy Studies at the Heritage Foundation in Washington, D.C. Dr. Moffit brings to the Commission and to the conference today more than 3 decades of experience in health policy in Washington, D.C. He has been engaged in policymaking as well at HHS and OPM. And I think most significantly, some of Dr. Moffit's achievements in designing the Federal Employee Health Plan continue even to this day. Bob will describe the Where the Cost effort, why this movement is important to Maryland consumers, and the importance of getting people to talk about cost in a way that they find understandable. Dr. Moffit will be followed by our former chair, Dr. Marilyn Moon. She is an Institute Fellow at the American Institutes of Research in Bethesda, Maryland. She also has served as a public trustee of Social Security and Medicare in a previous period. Maryland's work has focused on the role of informing consumers, providers, and policymakers about aging and healthcare issues broadly. And her emphasis, she has a strong interest in consumer engagement in healthcare and healthcare decision-making. Dr. Moon will explain how Where the Cost fits into the broader picture of healthcare reform efforts to lower cost for consumers. Lastly, Ms. Diane Stollenwerk, a former MHCC commissioner, and importantly, also an owner of a small business here in Baltimore City, will provide her insights, first as a consumer, and secondly as a developer of the very types of cost and quality measures you'll be seeing today. Following Diane's comments, I will provide a demonstration of the site, and then we'll pause for some questions from the audience here on this important effort. So I want to introduce Dr. Moffit. Thank you.
Thank you very much, Ben. Good morning, ladies and gentlemen. I am really honored to have the opportunity to announce this groundbreaking initiative on behalf of the people of Maryland. As Ben mentioned, our website, Where the Cost, will shed light on the cost and quality of differences among Maryland hospitals, as he pointed out, that now, until really now, has been largely unavailable in a consumer-friendly fashion. At the center of this initiative is the website. It's a unique platform for educating consumers about cost and quality disparities across Maryland. It will enable them to become better shoppers of elective healthcare services and procedures. But the website is only one part of our initiative. We aim to begin a statewide conversation about pricing and quality disparities in Maryland. The ultimate goal is to improve healthcare affordability for all of our citizens. It will start a process where citizens will really start to ask questions, to start to probe, and to get satisfactory answers as to why costs are the way they are. We all know that healthcare costs are too high. For many of us, the current system is not only costly, but it's utterly opaque. Nobody really understands really what their billing looks like. The United States has the highest healthcare costs in the world on a per capita level, and on a general level, it's higher than anybody else. In Maryland, as the Commission reported just 3 years ago, Maryland's per capita healthcare spending is substantially above the national average. So we have to change our trajectory here, and that will not be done by simply imposing another rule, another regulation on the existing system, and then shifting costs from one sector of the healthcare economy to the other. Millions of dollars of cost shifting in the economy does not add 1 red cent to the value of patient care. These rapidly rising costs reflect a fundamental dysfunction in today's healthcare market, a dysfunction born of a lack of competition among providers as well as insurers, and an absence of price competition and, naturally, price transparency. Let me make this clear about this distinction, because I think a lot of people sort of confuse the healthcare sector of the economy with the general economy, and frankly, they're very, very different. In a normal market, prices reflect the real conditions of supply and demand, and prices fall or rise in response to those changing conditions. In a normal market, prices are accessible. They're transparent. They serve as reliable guides to affordability and the quality of goods and services. In a normal market, competition drives increased productivity. Technology is not a problem. Advancing technology is welcomed, and suppliers are encouraged to deliver better goods and services at a higher quality and lower cost. But healthcare is not a normal market. We all know that our system is plagued by perverse incentives, cost shifting, as I had mentioned, in many cases overtreatment, in some cases undertreatment, and the real costs are often hidden, and the prices, in many cases, are largely, I guess the best word is mysterious, especially if you get a hospital bill and you can't try to figure out exactly what you actually paid for. It's incredibly difficult for ordinary Americans to figure out what medical procedures will cost beforehand. And that difference, as you all know, can mean hundreds and even thousands of dollars more in out-of-pocket costs. This is especially the case when there are wide variations for the very same procedures in prices, even though Maryland has a 40-year-old hospital rate-setting system. Now, policymakers in this area, they disagree in many cases very strongly on many policy issues. But there is a very powerful consensus on the need to secure value for our healthcare dollars. Basically, better care at a lower cost. Price transparency, making healthcare costs publicly available, is a powerful tool to promote greater value in healthcare. This is a market-based remedy for a market-based problem. It is also a core tenet behind the Where the Cost website. Our website does more than simply present healthcare cost. It is really one of the first such government websites in the nation, if not the first, that presents cost data in a consumer-friendly format. Now, visitors at the site can find the average total cost at many Maryland hospitals for 4 common episodes of care: hip replacements, knee replacement, hysterectomy, and vaginal delivery. The website calculates 2 kinds of costs: the typical cost and expected cost. And expected costs include office visits, physician consultation, surgery, and physical therapy, and importantly, the costs associated with potentially avoidable complications. These are mistakes in clinical settings, failures, for example, to follow medical professional guidelines, and there are other system failures as well. Hospitals that have low total costs and low rates of potentially avoidable complications may offer Maryland citizens the best value for their dollars. Just because you pay more for a procedure doesn't mean that it's better quality. Sometimes the prices are just higher. So this effort that we're announcing today is just the beginning. Over the coming year, our commission will release price information on certain conditions, including conditions dealing with chronic care conditions and the management of those conditions, as well as outpatient and inpatient procedures. The goal is to release comparative information that is available to people on the performance of hospitals and medical groups and facilities and on a broad range of episodes of care. By providing this public information for prices for common medical procedures, our commission will enable Maryland citizens to match the prices with provider performance. This is not just simply a good idea for the Maryland Healthcare Commission. This is integral to our mission. It is one of the major reasons why we even exist, to help consumers do this. But for transparency to have an effect, consumers need to not only know what the healthcare cost is, they have to understand it, and they got to know how to use it. And we will support consumers in Maryland and in many ways by combining the site launch with an ongoing communications and social media campaign to show them how to put this information into action. We know that high healthcare costs are a big concern for a lot of people in Maryland and around the country. It's our hope that by starting this conversation about the cost to consumers, that consumers will be empowered to make serious choices, to create competition among providers, and at the end of the day, to lower their costs. That conversation begins when individuals, small businesses, small business employers and employees, large businesses and large business employers and employees start asking questions. Specifically, why certain procedures cost what they do and why they cost what they cost. For our part, as commissioners, this is just the beginning. We're policymakers. We're going to take as many steps as we can to improve access and control cost and improve quality within the statutory authority that is given to our commission. We need to find ways to spur competition in Maryland and innovation in care delivery. If we're going to be able to do this, hospitals and physicians will have to start to work harder. They will have to compete for the allegiance of Maryland patients on cost and the quality of care. If they do so, they will work hard and they will deliver better value. You all know the country is struggling right now to find a path forward to provide higher quality, affordable, and accessible care for American citizens. The benefits of illuminating both quality information and the underlying cost is something that we can all agree on, regardless of any other disputes we might have. On that note, it's my honor and a privilege to introduce my colleague, a former Medicare trustee and nationally renowned policy analyst and the former chairwoman of the Maryland Healthcare Commission, my predecessor, Dr. Marilyn Moon.
Thank you. As a recent participant in the healthcare system, I'm going to stay seated. I recently broke my leg, so I'm not getting around too well these days. But I'm very happy to be here. I think this is a really important initiative. It's very consistent with what the commissioners that I worked with a number of years ago and I worked on to try to help improve the healthcare system for Maryland. This is a difficult task. It's a long-term task. There are no solutions that overnight are going to suddenly have us have a wonderful healthcare system that is inexpensive and gives everybody exactly what they want. I think that should be crystal clear from the debate that's been going on for years now over healthcare. But the lesson I take from that is that everyone needs to be involved. Everybody has to take a part in this. Commissioners who regulate the healthcare system can help. Providers of services can help. Cost-conscious providers of hospitals and other places who want to hold down costs can help. But consumers have to get involved in this as well. And it's a very difficult thing to do. Many of us as consumers find it difficult to ask our provider, especially if we're sitting in front of them contemplating a complicated procedure, well, how much is it going to cost? Where are those costs going to come from? Which hospital should I go to, and is one better than another? All of those are important decisions that people need to take some responsibility for. And this kind of a website can really help. It's not going to be the solution. I don't expect anyone to go in and wave the information from the website and say, I must go to Hospital A because it is the cheapest. That's not what's really involved here. What's involved is to say there are differences, and it's an important conversation to have, why those differences exist, why your particular physician, for example, is recommending you go to Hospital A and not Hospital B, and even make them aware, in some cases, of these differences. You would be surprised how little physicians know, in many cases, about the costs of care at all, much less the differences in the costs of care at different places. So this is an important discussion, and I see this as a way of empowering consumers to essentially be a little nervier than they might have been in the past, and maybe wave the piece of paper around and say, what's up here? Why is this the case? It gives people permission, in many ways, to raise this important conversation. And we need to jumpstart that because it's been a very difficult conversation to take place out there. I think it's also important, as Bob mentioned, to have it be in one place where you can look both at quality and cost, and we'd all like to see more and better quality measures incorporated, but we're really in the early stages of improving quality information these days. But we need to start with something. Anyone can criticize it that it may be misleading in some ways, which is why no one should say, absolutely this hospital is better than that hospital, for example, but rather there are some important conversations that need to take place. It's also the case that consumers need to be able to sort through these data. While the Commission gets enormous amounts of data, you can't just put that out on a website with millions of lines of code. People need some help in doing this. And one of the things I found very nice about the website is that it has quite a bit of information, but not so much to overwhelm. But it does raise issues such as you've got to think not only about what the cost of the hospital care itself is, but of the other related costs, and whether or not there are untoward events, whether you have to go back into the hospital because things didn't happen right, or you have to have extra care because things didn't happen right. Those are really important things for people to think about as well. These are all these four conditions are all things that people are going to be making choices about and talking to their physicians about, talking to their neighbors about, and so it's particularly appropriate that we do that. When you end up in the ER, as I did 8 weeks ago, you're not going to be asking a lot of questions, and that's fine, that's appropriate. But we'll begin to change the whole nature of health care if we begin to ask these questions. And hospitals will know they're on the spot, doctors will know they're on the spot, other providers of care will know they're on the spot to think about costs. And that's what I think this is all aimed at, as really starting that process. So I'm very happy to be here today, and I commend the current commission and the staff who worked very hard on this and the people who were involved in the process to try to make sure that this was not just another website, but one that actually would be helpful to people, that people can look to for more information and to populate it with more and more information over time. So congratulations, guys, and everyone else. This is going to be a step forward, I think, for the state of Maryland, and hopefully a model for other states as well.
Thank you, Dr. Moon, Chairman Moffit. There's one person over the last 4 or 5 years that has been a stalwart in pushing the commission and the staff to do more in terms of both price and quality, transparency. And we're really delighted to have her come back today to give her perspective on this important initiative. Even as late as Monday afternoon, Diane was saying, asking important and pointed questions about the site. I expect that I will hear more pointed and important questions on what we are going to do next tomorrow. But please welcome Diane Stallenwerk to give us her insights.
So hello, everybody. I'm not a doctor. I'm not a nurse. I don't work for a hospital or a medical group or an insurance company. I run a small business. I have one son who has epilepsy, and any day now, I'm going to be a grandma. Any day now. I'm excited. So when I served on the Maryland Healthcare Commission, I represented patients, consumers, and the public. And several years ago, I helped start an organization called the Patients View Institute to gather and use patients' stories to help inform and drive policy decisions that would make healthcare more effective and more affordable. So most stories from patients include something about the cost of healthcare, how the thought of going bankrupt because of medical bills is overwhelming, how impossible it is to get prices in advance even if you ask, and how hard it is to ask because you don't want to offend the very people who you're dependent upon to help you feel better. So how medical bills also are so hard to understand, and of course, how it's all just far too expensive. I mean, even for those of us with insurance, the astronomical cost of healthcare can add insult to injury. I mean, sometimes literally, adding confusion and anxiety during life events that are already complicated and frightening. So even before I got involved as a consumer advocate, I paid really close attention to try to figure out what my healthcare costs were and why. One time, after being in a car accident, not my fault, but anyway, after being in a car accident, I got my car fixed, and that same week, the hospital bill finally arrived for an outpatient surgery I'd had to remove fibroid cysts. So on the car repair bill, I had them both in hand, perfect opportunity, right? On the car repair bill, I could see exactly what parts were ordered, what I paid for them, how many hours the mechanic worked, what I paid that mechanic by the hour. Now, one item on that bill cost about $1,000. It was called a sway bar. I had no idea what a sway bar was. So I looked it up, and then it made sense, given the damage to my car. So on the hospital bill, there were several lines that simply said surgical miscellaneous, surgical miscellaneous, surgical miscellaneous, and a few that said RX, RX, with different dollar amounts that all added up to about $6,000. So I called the hospital, and they said they didn't list specifics because patients won't understand what it means. Now, it's my body, and I have a right to know what you did to it, what you put into it, and what you're charging me for. And today, we should also start asking why the price is so high. So we've made a little progress since then, and emphasis on little. In the last 10 years, I've worked in a number of states to produce public reports on healthcare. And the typical reaction of many hospitals and medical groups or doctors is to support transparency and then to pick apart the methodology, or pick apart how the information is displayed, especially if it's easy to understand. So some reports have information about charges, but that's different from prices or the actual amount paid by insurers and patients. That's why I am so pleased to be here today. This has been a long time in coming, and I am very excited to help unveil this website called Where the Cost. It's not the total solution, as has been pointed out, but it's a groundbreaking step in two really important ways. So first, it talks about the real dollar amounts paid for certain services based on realistic groupings of the kind of care that's involved in having a baby or having a joint replacement. So why are these prices so high? And why is there such a big difference in the price at one hospital system compared to another? And let's shine a light on it. I mean, let's get people talking about it and then get everyone to do their part to help make healthcare more affordable, especially for patients and their loved ones. Second, Where the Cost presents price information in ways that normal people can understand. Friends and family and neighbors, people in the checkout line and people on the front lines, everyday people will be able to understand this website. That's not easy to do because the healthcare system is really convoluted. And around the country, too many public reports are really complicated. They're so complicated that you have to have training in statistics in order to understand them. That is not real transparency for most people. So Where the Cost is groundbreaking, and it's a solid start, but it's not enough. There you go, Ben. I want to know what's next. I mean, what actions will be taken to reduce the cost of healthcare and reduce the healthcare prices? I mean, each of us can review this website, we share it with others, we can tell our own stories about the cost of our own healthcare and ask upfront what our healthcare options are and what the price will be or what it will cost. It's not too much for patients and family members to be able to expect and receive high quality and affordable healthcare. So consumers are definitely one piece of the puzzle, but everyone has a role to play in this. Hospitals and medical groups, insurers, employers, and policymakers. You all can see this website too. So that role is really important. And what are each of you, all of you, going to do to help reduce the price of healthcare? I mean, for starters, we can learn from the hospitals who are at the lower end of the price spectrum and then find out what they're doing right and follow that. Hospitals and doctors, make price information for people available for people up front before they ask and before they get care from you and it's too late to do anything about it. And employers and others who oversee contracts, use your negotiating power. So this website will help all of us, including each of you, recognize that we have a real problem here, and we need to take this work seriously in order to make healthcare more affordable for everyone. So let's celebrate. This is a step in the right direction, but keep going. We have a lot of work to do. Thank you.
So thank you, Diane. Now, there's one technical question I want to find out. Who's going to be running the website? Okay, we have someone. Thank you very much for that small technical correction here. Before we preview the site, I'd like to talk to you a little bit about how this initiative originated. The key point about the slogan, Where the Cost, I think you've already linked into how that came about based on what Diane just talked about, and then walk through one of the particular episodes. The messaging and the slogan for the site really was a very deliberative process that we established more than a year ago. We engaged a very creative consultant that really said, step back, look at the sites that are out there, and recognize there are significant limitations. You might call our site a little more kitschy. I call it more consumer-friendly, trying to reach consumers where they are today. Through that process, and that included focus groups and consumer research, we learned that people wanted to know more about healthcare costs, but at a level and in a manner they understood. We also learned about the hesitancy and the reluctance of people to talk with their healthcare providers about healthcare costs. I know all of us have sat in a room with a physician or other caregiver and thought, how much does this cost? But I really don't want to ask him, perhaps, or her. Perhaps they'll think I don't have insurance, or perhaps as they're about to do a complicated procedure suggest I have some question about their competence. So we've stepped back and not asked those questions. The reluctance to talk about cost is a major limitation in our ability to control cost. Just like everything, if we don't talk about it, it seldom gets addressed. We also wanted this reluctance to be addressed in a very direct way. And today you see a number of people wearing our T-shirts, which show for the 4 episodes of care the average price of those episodes here in Maryland. We think everyone likes a nice new T-shirt. We think everyone really likes a nice new T-shirt with a message. So we hope that you'll not only wear that T-shirt today, but you'll march through your shopping malls and go to your food bazaars and your farmers markets, your concerts when you, or your grocery stores, and wear those shirts, because we want more people to ask those questions. Where the cost, we think, shows that people can be open about talking about this topic and discussing it with friends and families. We know that recent consumer research has shown there's a hunger for information on cost, but oftentimes consumers don't have information they can use. The information, as we've talked about before, is available but largely impenetrable to the average consumer. Recent research supported by the Robert Wood Johnson Foundation has shows that people do want information on cost, and they would like to have a site where they can comparison shop, and it's easy to use. They are tired of seeing pricing and transparency sites that are filled with spreadsheets, billing codes, DRGs, ICD-9 codes, and all the jargon that makes healthcare work as it does in this country, but doesn't give us any insight onto what really is happening or enables consumers to understand how they can have an impact. With Where the Cost, we're trying to break through all of those barriers slowly. We're very pragmatic. We understand consumers are never going to shop exactly for healthcare like they shop for their shoes, but we can make important breakthroughs. Consumer engagement is important to further price transparency, and it is also important as Maryland moves to adopt some very ambitious delivery reform initiatives that we are moving forward even as we speak today, but cannot, we believe, fully succeed unless consumers play an active part in those delivery system reforms. Now I'd like to stop and walk you through the site. What I'm going to do is focus on one particular episode, vaginal delivery. We're doing that today because, in a way, this is a birth as well, but maybe more importantly, since we're starting out with information from the privately insured population, that is, individuals largely under the age of 65. More to come on Medicare later, but today we're focusing on the privately insured, and we think this particular episode is especially important to that population. So on the home page, and we've already moved beyond it, you'll see 4 panels: hip and knee hip replacement, knee replacement, hysterectomies, and vaginal deliveries. It's important to emphasize that the software methodology that we are using can construct over 90 different episodes of care. We've been very conscious and focused on selecting initially those episodes that we think are very shoppable, and we believe all 4 of these are. So on the front page, you'll see 4 panels. We'll move then to the vaginal delivery page, and right at the top, you can see what the average cost in Maryland is for a vaginal delivery episode, which includes not only the hospital cost, but the physician cost, the pharmacy cost, and perhaps in some instances, some outpatient services related to that birth. These are all part of the episode of care. Today, even savvy consumers can't get that information. Today, if you call your insurance company, they're going to have a hard time telling you what the total episode costs are for any particular service. And certainly, we know that many providers, because they deliver only a segment of care, can talk about their cost, but can't talk about other costs in that particular episode. When you engage physicians, they'll say, I'm really surprised about the hospital cost that you're going to have to be responsible for, or your insurer is going to be responsible for. I can tell you about the physician cost. I can't tell you about the hospital cost. Conversely, the hospital will tell you the same thing. So it's very hard for a consumer to really understand what's the total expense for a particular needed service here in Maryland. These are all, what we're seeing is the total cost, and they include two important parts. One is what we would expect to pay, and the other is what we would call potentially avoidable cost. And on the next slide, you see that we can break that out. The software that we are using can categorize services into routine and expected cost and into potentially avoidable cost. Routine costs include the delivery charges by the doctor, nursing care during delivery, the doctor visit post-discharge, postpartum care, various tests that may be needed as part of that delivery. Unexpected cost could include severe hemorrhaging and the treatment that is needed to address that condition, various infections, kidney, urinary tract, bladder infections, various breast infections, mastitis, for example, that we wouldn't expect to be associated with the delivery of a child, but sometimes are. Those potentially avoidable complications vary from institution to institution. And when we look at the 22 or 23 hospitals for which we have information for the privately insured in Maryland, we see that there is quite a variation, not only in the total cost, which includes the routine expenses, but also the potentially avoidable cost as well. This is where we think shopping can really make a difference, as well as shine a light on where improvement is necessary from the standpoint of hospitals and physicians. As you scroll down further, you can examine a more detailed grid, a table, if you will, that provides some additional information. We call this the table for really those that want more information. This is a scrollable table, and you can sort the entire table by clicking on any one of the particular columns. So if we sorted on total cost, for example, we would see from lowest to highest a ranking. Similarly, if we looked at your potentially avoidable complications on the far right, we would see a ranking on the complication rate, which is an important metric to examine as consumers begin to compare cost and quality for this particular service. So how are we going to engage consumers, I think is an important point. We've touched on it, and there are three key roles. We plan to educate consumers through the site. We hope to engage consumers in the information presented there. And then lastly, we want to encourage consumers to take action, the most important E in those three E's efforts. This is a platform that we really think is interesting to consumers in an engaging way. It provides information that deals with these particular issues where they are, is not aimed at a clinical audience necessarily, but recognizes that variations in healthcare are a complicated topic, and we need to start from a very simple place to break through. Where the cost is a simple site, I believe, but it makes significant progress in making price variations more understandable to average consumers, which is what we want to do. We think where the cost is, importantly, a call to action. And you'll notice that at your leisure, we encourage you to play the lead-in video on the site, which really, in a very friendly way, breaks down the challenges that many people face. Where the cost also is designed to help educate consumers who are already engaged in that topic. To supplement what we're doing today, we're also launching a very important social media campaign, and we'll do outreach to various advocacy groups, various employer groups, various healthcare groups in the state to spur discussion of this important topic. We want consumers to feel empowered to take action, to discuss costs with providers. If they need a procedure, to be able to talk honestly with those providers on what the alternatives may be, what the costs may be, and also recognize that this is an initial step in a longer journey in terms of increasing price transparency across the healthcare system. The 4 episodes are just the beginning. We have 90 episodes we can report on. We are being cautious. We are engaging healthcare providers, both hospitals and physicians, to get their insight as we roll this out. But we think we are not stopping with 4. We will be adding more episodes. We will be adding Medicare information shortly. And our hope is that knowing that what the cost is something the public can take for granted one day, that everyone will understand healthcare costs better and have an opportunity to easily access information that can help them make more informed decisions. Not only on this site, but we hope that this effort leads to the blossoming of other information across the state, that we are not alone, that others will pick up the challenge and make this information available to the public in ways that we haven't yet thought of, but may help other segments of the population. It is just a beginning, and we think that this is very important, that we have this discussion where we bring not only the providers, but the public, consumers, employers in particular to the table and talk about the range of healthcare costs here in Maryland. I'm going to pause here now and ask the developer of the methodology that was used for this Where the Cost initiative, Francois Debrant, to join me at the table. I'm going to stay here, and we're going to take some questions from the audience. First, a word about Francois. He is vice president at Alterum, and he's the director of the Healthcare Incentives Innovation Institute at Alterum. He's been a staunch advocate for greater price transparency, but he's also been a strong supporter of delivery system reform. And if you look at the Alterum site, you'll see not only are they engaged in transparency efforts, they're also very heavily involved in the development of alternative payment models. Sorry, we have to drop into a little wonkish talk here. But we are, in parallel to transparency, we need new payment models that incentivize hospitals, physicians, and other healthcare providers to deliver value in healthcare. Alterum is doing both, and I want to thank him for his work on this project. And now I'll pause for some questions from those who are here in attendance. So maybe to begin, to get this going, I'll just pose a question to Francois. You've been involved in price transparency efforts. What are other states doing? And we've talked about how much Maryland wants to be a leader, but can you describe efforts in other states that parallel what Maryland is doing?
Certainly, and thank you, Ben. In fact, every year for the past 5 years, we've been issuing a report on price and quality transparency in a number of different states in every state in the country. And most states so far have gotten an F because they have no initiative, or their initiatives are relatively weak, as was mentioned by Diane and others. So, and without preempting, because our new report card is going to be issued in a few weeks, The scores haven't changed much for most states except for Maryland for reasons that should be obvious today. So there is a dearth of information around price and quality in most states across the country. And I think what's exciting about the steps that Maryland has taken is that not only, as Diane, Bob, and Maryland have mentioned, it's different from what other states have done, but it's also been done in a manner that can be replicated by other states easily and engage in this conversation about wearing the cost way beyond this state and into others.
Thanks. Well, I'm sure Commissioner Stollenwerk would say, don't grade us too high. What was our grade last year? If you would...
I'm pretty sure it was an F.
So we can only go up. So
Exactly.
that is also a good thing. As we're
It's an opportunity.
In fairness, most of the other states across the country also had grades that they wouldn't want to show their parents necessarily. Other questions? Diane.
So in staying on the policy wonk thread and the comments about changes that are happening in the healthcare environment generally, Maryland is unique in that we have the waiver. Could you talk a bit about how the commission would like to see hospitals and their partners within the health system, particularly under the cost pressures of the waiver, how they could use this information to address price and cost issues?
I think the waiver gives us an opportunity to do things that are very different. Certainly, the waiver has imposed on us, with the waiver, we have a limitation, overall limitation on what we can spend. I think the way in which this can work within that framework is that by providing the public information on what is actually happening on the ground, the intensity of competition will start to rise among hospitals because, frankly, this information will now be available. And as a result, I think what we may see is we may see innovation in care delivery within the waiver. It is my understanding, I have been not involved in any of the conversations with the federal government, but it is my understanding that the CMS, who is responsible for running this waiver, is very much in line with the idea of promoting patient engagement, intensifying the competition among providers, and promoting innovation in care delivery. So I think that giving this information out will stimulate providers in hospitals and other institutions, but hospitals primarily, to try to look at ways to actually deliver a better product. So I think the waiver is compatible with what we want to do. I think the job of the commission, we're a regulatory body, and most of the time when we talk about a regulatory responsibility, we're talking about restraining or guiding or directing, providers. And that is certainly what regulatory bodies do. My view of it is that the commission, working with our sister commission, the Health Services HSCRC, that our function should be to promote, allow, permit, and encourage providers to do things that are new and different and imaginative to deliver care, and in doing so, start to bring costs down. So I think, there's not a direct relationship here, but I think that they're not incompatible.
I'd just add that I think one of the interesting things about an all-payer system is that you take out of the equation the notion of pitting payers against each other, of what will Blue Cross pay, what will Medicare pay, et cetera. And in that sense, it opens up the ability for hospitals to be more creative in terms of looking at costs and thinking about what can we do across the board. And I personally think one of the interesting things, especially when there are more examples that are available, for a hospital to say, why are we so high in this area and not in that area? And then they have the ability to go to let's say, the delivery world and say, you guys are doing a great job in holding down costs relative to other hospitals, and our knee replacement folks are not. So what can we learn from each other? So I think there's some opportunities here that you might not see in other environments, and that this could be really a boon to hospitals to think about things as well.
Other questions?
First, I want to congratulate everyone on the commission for creating this amazing and potentially transformative project. And my question is, what are we going to do to make sure this lives on in the minds of the consumers and make sure that they make Wear the Cost their first port of call whenever they're seeking out healthcare treatment?
So I think this is the first step in a much more ambitious effort. 4 episodes. We have 86 maybe to go. We especially like this methodology because it enables us to move beyond the inpatient setting, that there are a host of episodes that have been created under this, the framework of the software we're using to develop outpatient episodes, episodes in which a hospital is not involved at all. And that's increasingly where care is moving to today. We are also, like most states, plagued with a significant part of our population that has multiple chronic conditions. How we manage that is still a evolving science, and understanding what the choices are, what the costs are, what the outcomes are going to be increasingly important. So this is a first step. Our next step is moving to the same set of episodes for the Medicare population, and then moving back and updating and expanding this on a, I wouldn't say quarterly basis, but on a frequent basis. So we can assure consumers as well as the healthcare providers that the information is as current as it possibly can be. I think that this fits into the larger constellation of price transparency, and we'll be looking for innovations really among our colleagues, among other states, and even among health systems in terms of how they can portray costs in a fair and consumer-friendly manner. Other questions? I want to thank everyone for attending today. Oh, wait, we have one more question.
Hi, I know that one of the potential limitations or one of the areas that you're looking to expand is for more self-funded employer data to be aggregated into the system, and that you need permission for that to happen. As you probably well know, self-funding is moving down the chain, and smaller employers are becoming self-funded. So employers who are only slightly more engaged than the people on that sign right now. And so I'm wondering whether the health plans are engaged strongly in this project. They certainly should be. They stand to benefit from it strongly. And could we expect to see health plans reaching out to those smaller and smaller self-funded employers to encourage them to release their information to this website to make the data even more robust?
So I think it's an important question. As I mentioned, this is for the privately insured. We had as one of our quality requirements that to be included, we had to be assured that we had inpatient, outpatient, and drug information available. So the question of self-funded employers, they submit to the medical care, the database we call the medical care database, similar to databases that exist in 17 other states, but they do that on a voluntary basis. I agree with you. Large carriers who serve as the administrator for many of these plans have an important role to play. We have been working over the last year, since federal law in this area has changed, to work directly with employers, both large and small, to contribute information. We have a number of significant public employers who are self-funded that contribute, and we'll be looking to expand that to self-insured employers over the next year. your assistance. I should mention that Mr. Miller is head of the Mid-Atlantic Business Group on Health, and his organization has a key role to play in encouraging that participation as well. So thank you for the question. Other questions? Thank you very much for all participating in this meeting. Please wear those shirts, share that website link with friends and family, and we'll look forward to the next phase of this initiative. We haven't quit now. As I said at the start, where the cost lives at the Maryland Healthcare Commission. Thank you very much.